Hi, thank you very much, Global C.R.E.D, for having us here today. And we thank you to the Seal of Biliteracy and the language community for not just joining us here today, but for being interested in the topic that we're here to speak about. I am joined today by an amazing panel. Truly, it is my honor to be among them. And I will introduce them as they come up and actually speak their piece in the panel. But I just want to kind of read their names right now. Gezzer Ortega will be joining us today, Wendy Klein, Frida Adams, and then from our company, Genie, it will be Fenstermacher, and then me, Kirsten Brecht. And I just want to start by telling you a little bit. I'm the CEO and co-founder of Genie. And I want to tell you a little bit about who Genie is before we kind of dive into the panel, because I think that this will give you a little context of why we're here today. So we start our presentation. I'm just going to kind of go through a few quick slides just to kind of establish, if you will, our street cred in the language industry and why you may kind of want to listen to anything we have to say today. Genie is a mobile platform that connects you to a video or voice call with a live interpreter for on-demand language assistance 24/7. We've taken a very different approach to this industry. And we've, our whole team, our leadership team, our founding team, myself and my co-founder, Dr. Richard Brecht, we've been language people our whole lives. And we looked at the language service market and we really observed a need for a different kind of approach, again, to providing language services on demand to people who needed them. And at the same time, we were lucky to be a young, thriving tech company and watching all of the gig economy models popping up in various marketplaces, and to see an opportunity for us to take advantage of that kind of a model where we could literally connect interpreters from all over the world with varying degrees of proficiency and capability and talent, varying domains of talent and areas of expertise and certifications, and put them directly in touch with people who needed language assessments and assistance literally in seconds. And so we're very kind of pleased today that we now have interpreters in over 135 countries. We have customers currently in over 150 countries. We are doing interpreting now in dozens of industries, and that includes supporting over 40 plus areas of healthcare practice today. And the reason we do what we do, the reason why our whole team has been committed to establishing a whole new technology, a really brand new mobile platform built on entirely kind of new, not just technology, but also new concepts, new philosophies. And we're doing that because we fundamentally believe in this mission of putting the access to language literally in the palm of your hand, in anyone's palm of their hand, so they can have access at any time of day, because we believe that language is access. Language is participation. It is equity. It is power. In our minds, it's a fundamental human right. And we see right now that that is growing consistently across the world. And the focus on language and the focus on incorporating language in industry is growing also because of growing global patterns. And those patterns are about larger expat communities in different countries. They're about increased global commerce. They're about international content sharing through social media and everywhere else, as well as a fundamental and important increased focus on human rights and inclusion now across the globe. And as a company, this has all culminated for us in what we've seen now as a growing demand for language in many industries. And you see that this is a list you have in front of you of industries that we're currently responding to with language demand. But today we only have time to kind of focus on one. And today we're going to actually focus on healthcare as a use case, not just because it's so central, but also because it is so relevant to what is happening in the world today. The US has a promise that everyone, all patients, deserve access to care. And our position is that this promise is currently under threat. This promise is currently not being delivered. And there are a variety of factors for that. There are a variety of things that affect equity in health. But one of the factors is language. And language happens to be one of the elements that we can control. While there are other factors that are outside of our control, language is one that we can actually provide in order to overcome some of these barriers. And we see language barriers as being a leading source of inequity in healthcare access, of misdiagnoses and mistreatment. That's not rocket science. If you can't communicate, you can't communicate your symptoms. Someone can't understand how to effectively diagnose or treat you. And it's also contributing to patient illiteracy. If you don't have access to the information that is out in the community that everyone else has access to, how are you as informed as everyone else is? It's also contributing to patient mistrust. And this will lead to a lack of adherence in treatment protocol. All of these different things, which end up kind of waterfalling into different and kind of unfortunately less than effective outcomes at best, but loss of life at worst. And what we see now is with this burgeoning kind of use now of telehealth technology, that gap is widening. And with social distance, that gap is widening in terms of the people who we are able to treat and who are being treated equally and equitably. All of this is culminating in what we say is the US healthcare's multi-billion-dollar problem. And it's a multi-billion-dollar problem that is growing. So there are hundreds of thousands of caregiver-patient conversations happening every day. And those numbers of conversations continue to grow as the number of patients in our system continue to grow. And the number of patients in our system are continuing to grow right now for a number of reasons, including COVID, which we'll discuss in a minute. But the number of people in our country right now that don't speak English at home as a first language is also growing. And as we see that this is kind of culminating, as we said, in at best billions of dollars of lawsuits for our healthcare providers because of the misdiagnoses and mistreatments resulting from ineffective interpretation and communication. But again, at worst, it's resulting, most unfortunately, in loss of life. And COVID has only highlighted not just the problem, but also kind of the risk that we're taking by not having language interpreting and language immediately accessible to everyone. Also, therefore, showing the significance that language has in this industry. There are more patients in our system. That means that there are more languages and more language challenges currently in our system. Social distancing has meant that even though bringing friends and family along to healthcare appointments is not really compliant with protocol or law, that you no longer can bring friends or family with you to certain appointments. That means that you have a whole other set of interpreting issues. It also means that in-person interpreting is not available at a lot of the healthcare provider facilities where it used to be, or it's much more risky than it used to be to the physician, to the patient, and to the interpreter. And our move towards telehealth means we now have to be able to communicate with patients in a whole different medium, which now means that there is more pressure to ensure that everyone, again, has access to those telehealth consultations, to that medical consultation, to the mental health consultation, no matter what kind of technology they have at home. And all of this, which still needs to be done in the context of HIPAA compliance. So one other kind of point to add here, it's funny how many people are not aware of this, but it also happens to be the law. Both the ACA and the ADA protect patients by saying that healthcare providers have to provide on-demand, on-site interpreting whenever it's needed, no exceptions, no reschedulings, no turning people back and telling them to come back later, all at the healthcare provider's cost. And this shows that as a country, as a nation, we have actually embraced the significance of this. We've even enshrined it here in legislation. And so it means that we see the problem and we see how significant it is. We're here today to talk about the fact that it's now time for us to live what that really means. It's time for us to embody the significance of this and to deliver the language access that these points need in healthcare, let alone in the other industries, which we've referenced earlier. And the wonderful panel that I have today is here to talk about not just kind of the problems and how, those problems are manifesting in their various environments, but how we see the solutions, coming into play, how we see the access to language interpreting changing what those outcomes can be, and how an absence of language in the context that they're discussing is detrimental. So I'm going to turn over now the microphone to our first panelist. And our first panelist is Gezzer Ortega. And Gezzer is the lead faculty for research and innovation for equitable surgical care at the Center for Surgery and Public Health, Brigham and Women's Hospital, Harvard Medical School. Dr. Ortega is a health services researcher with a focus on developing and implementing solutions to address surgical inequities. He is also co-founder of the Latino Surgical Society. Currently, he has focused his research on improving outcomes for surgical patients with limited English proficiency, and we are quite proud to say that we are co-applicants with him for some grants coming up, which we're all very hopeful will kind of produce more wonderful work that Gezzer has already produced. And Gezzer, with that, I will turn it over to you.
Thank you, Kirsten, and thank you for setting the stage. And I will talk a little bit about just this, the language discordance issue and the issue that we have within the United States within the scope of surgery. And so in 2017, more than 25 million patients with limited English proficiency were identified in the United States, which means that 1 in 12 are at risk for adverse events to language due to language discordance. And so I'll define language discordance here as a patient and provider not sharing a common spoken language. And then for the LEP status is just non-fluent enough to understand or engage in medical discussions. And we always go back and forth within the literature and in the academic world with the use of LEP. It may not be the best terminology, but it is the most commonly used in what we have currently in our academic world. And so with that, the impact of language discordance on health is huge. And this ranges from anywhere between acute conditions such as surgery to chronic conditions before, during, and after medical interventions. And they include, but not limited to, and Kirsten mentioned some of these, but understanding of the disease and the treatment is critical. Shared decision-making, satisfaction with care. It leads to uncontrolled high blood pressure and asthma. Studies have demonstrated worse medication and understanding and compliance, worse presentation for surgery and outcomes after surgery, longer hospital stays, increased readmission. And all of these lead to inefficiencies within our healthcare system. They lead to increased or worsening outcomes for our patients. But more importantly, one of the things that I want to highlight is that a lot of this is not even captured within the current literature and within our research, because there's so many interactions and so many encounters that happen that are not documented within the confines of our research. And so one of the complexity of this research and the work that we do is that, and I'm just showing the patient level factors here, is that there is so much that contributes to it. There are sociodemographic factors, there are clinical and psychosocial factors, behavioral factors, the care process itself, but I'm going to focus on the patient-physician systemic interactions and within that communication. And the reason I'm focusing on communication is because in 2015, the American College of Surgeons and the National Institutes of Health here in the United States met to discuss what are the key issues or the key interventions that can be done to address surgical disparities within the United States. And communication specifically between the patients and providers became one of the top items on their agenda to address in order to mitigate some of the disparities that we see in surgical outcomes. And those would be in healthcare outcomes, readmissions, and postoperative complication rates. And so with that, what I want to say is interpreters can help. Many occasions in which I've been working in, there have been instances where having a live interpreter, having access to interpreter services, having someone readily available is important, because when your patient has preoperative education or information that they need, or just education on managing their wounds or managing their care, it's important that they fully understand that so they can maximize the scope of their outcome. And so we can't rely on physical gestures, family members, or just minimal patient language knowledge. The decreased communication throughout the day due to increased work to get an interpreter have been some of the reasons why people kind of, stress the need for more readily available interpreter services. And then many forms are just not translated into other languages, which is crucial. I mean, we've seen most of hospitals will cover some of the more common languages, but there's so many languages and so many patients that we see on a regular basis that we just can't meet that need by just direct translation of these forms. There needs to be better interventions. And so I'm happy that we've been able to partner with Genie to look at some of these interventions and to figure out what these solutions are. And the next couple of presenters will also highlight some of these things.
Thank you, Gezzer. Thank you very much for that. Just fascinating stuff and such wonderful work that you're doing. We really appreciate it. And we'll come back to some questions probably at the end of the panel. And with that, I'd like to introduce Wendy Klein. Wendy is Dr. Klein is a former internist who served on the faculty of the VCU School of Medicine for 25 years and co-founded the award-winning VCU Women's Health Center, which many of us have known about for so long. She is also a gubernatorial appointee to the Virginia Board of Health, upon which she currently serves. And most recently, which is fascinating, she was asked to serve on the Virginia COVID-19 Testing Advisory Council and the Virginia Vaccine Advisory Work Group, where she co-chairs the communications and messaging subgroup. So if you want to know what's kind of going on in the world of COVID and vaccine distribution and everything else, Dr. Klein here has all the information. And today, Wendy, we thought you could just sort of talk to us a little bit about what are the growing trends that you see right now in challenges presented by not having, the right language, why you see language as being so essential, and maybe just also a couple of comments on how that has changed with COVID, both in the context of your testing, contact tracing, and now vaccine work.
Thank you so much, Kirsten, and thank you to Dr. Ortega for doing some of the great work that you are doing. I am the boots on the ground, where for the last several years, I was medical director of what we call a safety net clinic, which is a clinic that takes care of the least served patients, those who cannot access healthcare in any other way, and who come to us with many barriers. When I came there in 2015, about 25% of the patient population spoke languages other than English. Last year, at our last count, approximately 60 to 65% of our patients spoke languages other than English. What we were using was a very clunky, older interpreting system that many clinics and hospitals use in the United States, where a patient spoke into one receiver, telephone receiver, the healthcare provider spoke into another. There was a remote interpreter through which we communicated. We were not able to appreciate visual cues. There was tremendous inefficiency in having to wait for responses. And I think a great deal of nuance was lost because there were no visual cues, and it was such an awkward system. Once we were able to use the Genie mobile app with on-demand interpreters, it made a huge difference for us. As Kirsten said, when COVID happened as well, we moved to using telehealth platforms a great deal of the time, and that it became even more important to have the mobile app with the on-demand interpreters, where we could call upon a multitude of languages to help us understand our patients and for them to understand us. One of the things that's lost, of course, is in the older interpreter systems is having the patients have a good opportunity to ask us questions and for us to validate that they understand what we want from them, because all of our recommendations are only as good, obviously, as the degree to which they are understood. So moving into this new technology has been amazing. As Kirsten mentioned, now we are faced with all the challenges of disseminating vaccine information, dispelling rumors, myths, misinformation, which is abundant, as everyone knows. And that's just one aspect. The other, of course, is COVID contact tracing. So there are so many uses for this new technology that has helped us take care of patients. We're happy to discuss questions at the end, but that was really what I wanted to say.
And Wendy, maybe you could just also comment on, what does it mean? What's the risk now if, we don't have kind of that immediate, really within kind of seconds, access now as we try to, roll out more COVID testing, as we try to kind of track, the contacts that have been made, and as you work with your commissions now on how we get vaccines to everyone?
It's as we said, I mean, it is critical that communication and interpretation be available, since, as you all know, COVID is changing and evolving our understanding, our treatment, our recommendations, days of quarantine, how to isolate, how to take care of your family, what things we need to do. The issue of vaccine distribution is going to be very, very challenging. So I cannot say strongly enough how important I think this is going to be for our team, particularly at Health Brigade and the other free clinics that are using Genie, where we can access interpreters, specific to the need. It speaks for itself.
Thank you very much, Wendy. I know we'll have a lot more questions probably coming in towards the end of the panel, but I really appreciate, you being able to kind of be here today and share, what is, again, like Dr. Ortega, Dr. Klein here has, on the ground sort of very relevant experience watching what's happening every day in terms of challenges where language, assistance is not present, and the difference where it is. Thank you. And we'll obviously have time to come back to Wendy and everyone else. And in the meantime, I'd like to just kind of go over to our next panelist here, Frida Adams. And hi, Frida, how are you?
Good, how are you?
Good. And I just want to take a few minutes to introduce you. I was working on all of these bios today, and I have to say to everyone, Hans and I, from the Genie team, we just, we felt so inadequate putting bios together for you and Wendy and Gezzer. You're just such an incredible, impressive bunch of people doing amazing work. And Frida is the faith-based organization liaison for Heart for the World Global in Las Cruces, New Mexico. She's also the former director of New Mexico Office of Border Health and delegate of New Mexico's Secretary of Health to the U.S.-Mexico Border Health Commission. She spent her career domestically and abroad in humanitarian services, and she's coordinated medical responses for New Mexico asylum seekers, and currently is assisting shelters in Mexico as well, on the Mexico side of the border, housing asylum seekers as the facilitator for the Las Cruces Hospitality Coalition. So Frida, I'm going to turn it over to you.
Okay. Well, thank you for this opportunity, and hello, everybody out there. So I'm going to give you just a little more of probably an on-the-ground picture. I'm not an academic. I just take care of people. So I want to just make you aware of the situation at the border. I'm sure everybody saw on the news, a year or so, 2 years ago, when it all began to become newsworthy, what had been going on for a long, long time, and that was the surge of folks coming from around the world, actually, not just from Central America, through our southern border with Mexico, seeking asylum in the United States due to various factors and none of them good. Nobody does that if life's good where they are. You don't leave everything you've ever known to travel across the desert in 110, 120 degree heat in the middle of the summer, or the terribly cold winters with nothing but what you can carry, seeking safe refuge in a country that you've never even seen, and the language that you certainly don't understand. Many of these are hill tribes people, indigenous folks that just have had unbelievable suffering and have made thousands of miles journey on foot to try to find safety and refuge. And so that's where I had stepped in first in my role with the state of New Mexico with Office of Border Health. And then I resigned that position in order to work full time with the refugees and asylum seekers during that surge. And so challenges, current situation, when the Remain in Mexico program was instituted late last summer, which is the official name of its Migrant Protection Protocol, these folks were no longer allowed to come in to the United States and approach the first official, they say, and request asylum. They're sent back into Mexico to wait for an opportunity to have their cases adjudicated. And with COVID, then now none of that's happening. They're not having the court cases and stuff. So they're stuck. They're stuck in along the Mexico side of the border. Same folks, just on the other international border, just across, across the bridge. So I just want y'all to understand the current situation of those folks. We don't have good numbers. It's impossible for us to tell you how many people are there, but we do know it's tens of thousands of people who are in shelters on the Mexico side of the border. Some of them are out in the community, and those we certainly can't count. So it's hard to get a count, but it's tens of thousands of people. And the situation that they're living in is dismal, without adequate food, certainly without heat, without adequate medical care, many of them without even the simplest thing as a Tylenol for fever or a cough drop for their throat, much less COVID symptoms. They're doing the best they can. And so, Mexico's done a pretty decent job of trying to care for them, but it's just overwhelming. And they just do not have the resources to adequate care. So when I'm saying all of that, the condition that they're going to come to us in is going to be a result of the conditions they're in now. So that's the backdrop of what's happening. And again, remember I said these are Hill Tribe folks, many of them, and some of them, they've come from Cameroon, many other countries. It's not just a Spanish language situation. So when they do come to us, when they do get across the border and are able to, and they go into ICE custody, they go through the Border Patrol, and then they're released out to us, which if the migrant protection protocols are reversed in January or sometime after January with the new administration, then these folks are going to be coming back to us. All this backlog plus other people are going to be coming in. These are mobile populations. I may have 24 hours to find out what's wrong with them, try to deal with anything that could become a crisis as they go to their destination. They're in shock. They're they're totally disoriented. They don't speak our language, and they don't trust us. And why should they? So having access to culturally and linguistically appropriate services is the game changer. It's the make or break for whether we can identify a health issue that could cost them their life while they're on the bus or on the plane, something that must be dealt with before they go. This is an ongoing thing. We were on the back of this, last year, and just trying to find people in the community, find people on the phone. So to have something like Genie that would be accessible on their cell phone, or being able to, and then it empowers the person to do it and not depend on the doctor, because I have volunteers, they're coming in every hour or two, so that's a constantly changing situation. But to have access to, so that we could rapidly triage that patient and then give them instruction on what they need, that would build trust really fast with us, with our patients. Also, we're into contingency planning. I'm sure everybody knows that. We're looking at what will we do if that is reversed, and we need to build in the culturally and linguistically appropriate services to contingency planning as people come back across the border, come into our shelters for just a few hours, sometimes a day or two, till we can get them on a bus or on a plane and off to their sponsors. So like I said, this is a make or break situation for healthcare, as well as travel arrangements and other things. We can use it for other reasons, but I'm a nurse. I'm going to look at, can I keep somebody from dying along the way that's made this journey, and we can get them safely to their destination. Just ongoing challenges, access. The best thing that's ever been invented is no good if it doesn't have access. So having access to that service, the technology, the financing for this. We need grants. We need organizations to help us be able to afford that. And the well-trained interpreters. And, many of these folks speak ancient languages up in the mountains of Central America. I saw the same thing in Asia. So it may be very hard to find interpreters. And so we certainly couldn't find them. And that's where a company that's their job to have these folks available for us at a call up situation is so important. And remembering that the mobility, that's also an ongoing challenge. They're on the move. And, trying to establish, you cannot do a 5-page history and physical. You've got to be able to quickly identify the major needs, and just cutting that time where I may have 5 or 10 minutes with that patient to decide, can you get on the bus or do we need to send you to the hospital? So anyway, that's kind of what I wanted to give as a backdrop for this situation. I'm really excited to see what's coming in Genie and other services that we could do to provide the very best for these folks who are the most vulnerable people, who deserve absolutely the best that we can offer them. So thank you.
Thank you, Frida. I'm sure you've got everyone's, I think I just lost you there. I was going to say, I think you've got everyone's, attention. And one of the things that you said that's just so critical.
I'm having technical difficulties. I can't hear you. I'm sorry.
Oh, okay. I think I'm off mute. Can you hear me now? I was just making sure that to add or to emphasize your point around the culture and language.
Yes.
And how, as we always say, they're inextricably linked. You cannot understand one without the other. And that cultural component is just so fundamental, and that it is one thing to have access to, bilinguals and to interpreters. It's another thing to be talking to somebody who understands, the part of the world that you come from, and, that it's not, Spanish is not Spanish is not Spanish. And so dialect nuance and cultural nuance is just so critical, I think, as we go forward and look at these issues. So thank you for bringing that up. Thank you.
Yeah, we do Google Translate. That's the best that we could do. But to have, and if anybody has never been outside of their culture and unable to speak with anybody, and then be sick or have a family member sick, be in a crisis, if you've ever been in that, then you know what we're talking about. But that's what we're facing. So to have that voice, to have that person that knows the right thing to say and how to say it, it's not just the words. It's translating in a way that they can receive it and be comforted and feel then more comfortable to share. That is absolutely essential.
I mean, talk about being able to kind of defuse a potentially very charged situation versus, further charging. Thank you.
Yes.
Thanks so much, Frida. I appreciate it. And with that, I am now going to turn it over to my wonderful esteemed colleague, Hans Fenstermacher, who is our Global Talent Ambassador at Genie. I'm so proud to be able to say. But Hans is also, he is a language person. It's just in his DNA for 4 decades. That'll shock you when you see him. You won't believe he's that old, but for 4 decades, he's been in language space. He was an interpreter. He started a language services company and sold that company. He has been in senior positions in, the most kind of esteemed language organizations like the Globalization and Localization Association. So we're so fortunate to have him here at Genie. And I'm going to turn it over to Hans, who is just going to talk a little bit more about, the fact that we're trying as Genie to kind of respond to the market. But we do want to just say that this is fundamentally a place where we just want everyone to get access to language. You can do it with Genie or you can do it with others, but we just want you to get access to language. So Hans, with that, I'll turn it over to you.
Right. Thank you, Kirsten. And it's a pleasure to be here among such esteemed company. Very glad to sort of have all this context framed for the conversation, and to sort of tell you how we think, Genie fits in. Basically all the things that we've been talking about, the sort of the diversity needs, the language access, the fact that situations are urgent, the fact that mobility is needed. We saw all of this need as we started up Genie, and we said there has to be a way to provide a more sort of mobile, flexible platform that can give the language access right away to the providers and the people that need it as quickly as possible. And whether you're a hospital or you're a clinic or you're a mobile crisis unit or it's a home visit, whatever it is, it's critical that that language be available and accessible right there on the spot. And so we developed the concept and platform around Genie to be this community of interpreters who are trained, who are medically qualified, who are ready to go and work on these difficult topics, but also immediately accessible and can jump right on an audio and video call so that we can incorporate as much of the sort of language and cultural aspects as possible in that response. And in addition to that, we wanted to make sure that this platform was something that was affordable. So many of the previous sort of traditional technologies and providers in the space relied on technologies and systems that were antiquated, that were slow, that were large, that were expensive, to the point where only really large organizations and hospitals could afford them. And we wanted to make sure that we could get this language access into the hands of everybody, so that the health access would be available to everyone, independent of whether they could afford it or not. And sort of one of the last key points to stress is that we wanted to make sure that this language access was fast. We wanted it to be something that didn't take a lot of time. It didn't take a lot of steps and a lot of hoops to go through to get to somebody. You heard Dr. Klein mention having to sort of have special equipment and having to have sort of all sorts of tasks and steps that you had to go through in order to reach an interpreter. We wanted to make sure that the distance between the person who needed the interpreting and the interpreter himself or herself was as short and as small as possible. And so we looked at the market and we said, there has to be a better way to move away from the massive sort of infrastructures that existed for labor forces that were paid and that were expensive and therefore had to be, had to increase the cost of access to the healthcare interpreting, to technology that was old and was very difficult to move towards the mobile and flexible environments that we're all trying to deal with, and ultimately, ending up with a very high price to pay in order to access that. And for us, Genie was the flip side of all of that. How could we be nimble? We could develop an assetless model that allowed people who are expert interpreters to be on the platform, to respond to the needs of the market right away, and at the same time create a cost structure that emphasized affordability and also emphasized a way of being able to pay the interpreters more so that they too could participate fully in this model. And so we're very proud to say that, as Kirsten mentioned, we have interpreters in over 135 countries, and that for a lot of them, this is a way for them to earn income in places where they have great difficulty earning the income. And so, we wanted to kind of respond to both sides of that marketplace and being able to provide affordability and access and flexibility right there, at the point of care. And so basically we developed a platform, an app that works very quickly, that in a couple of taps allows you to access an interpreter who can then come online and be there with you by video and audio so that you can engage with that interpreter, right away, whenever you need to, in as efficient and flexible a manner as possible. And, I can show you here, you'll see that we have a very simple interface, because the idea is choose a language, choose your need, and go. And if I tap the button here on our app, basically, if I were in the field, if I were, doing a home visit, if I were somewhere in a clinic, if I were in a tent hospital somewhere, I would be able to tap and within a few seconds have a language interpreter, come online and help me out, as needed. And the idea really is for that access to be in your pocket, to be fast, to be affordable, and to basically be there when you need it for as long as you need that access. And so, you can see that if you were out in the field somewhere and you needed an interpreter to connect, that interpreter would be able to be available to you at a moment's notice and provide the help that you need, as you need it. And I'm sorry. Hi there, Jose. I'm doing a quick demo here for folks across the internet, just showing them the accessibility of the Genie platform. Thanks for picking up so quickly. We appreciate it. I'll let you go. Thank you. But as I said, the idea here really is for fast, flexible, affordable, and immediate access to language. And we're very proud that we're moving quickly forward to add many more languages. We're especially very interested in working with folks like Frida and the free clinics like Dr. Klein's to be able to bring this sort of access to populations that really need it the most, and in a manner that is actually doable and affordable under the current structures. So with that, I think I'll turn back to Kirsten, and we'll see. I don't know if we have any questions, perhaps from.
We have a few. We have a few here, so I'm gonna read one or two of them out. And one of the questions, and I think Gezzer, this might be a good one for you to respond to, if you don't mind, is to talk a little bit about some of the personal, informal interactions in healthcare that are just not always the formal physician-patient, right? But even kind of like that less formal, whether it's patient intake or it's when you're moving kind of a patient from one place to another. Some of those communications, which may not always seem so significant because they're not delivering the diagnoses, but yet if they're done in someone's language, what kind of a difference can they make? Oh, I think you're on mute, Gezzer.
Sorry about. There was a study demonstrated, I'm happy to answer that question, that the average person in a hospital has about 60 different encounters with 60 different individuals or more. And so you could imagine that the provider, the physician, just being one of those encounters, and they may encounter multiple physicians because now most of the care is delivered by a team. And so they're residents, medical students, multiple different specialists. And so within each one of those, I think there are multiple opportunities in which if you had an application that was readily available, would assist the patient as well as the providers in doing so. But a lot of the care also happens at different levels. It's not just between the physician and the provider, but within nursing, within radiology, within the physical therapist. And so many other people that contribute to the healthcare team and contribute to the health of that patient. I will also, just because I saw one question in the comment about the medical terminology. And one of the things that is nice about Genie is that there are HIPAA certified and medical certified interpreters that help specifically with this. And so they're familiar with the medical terminology. But I also think one of the things that's key and that helps is also even having a conversation with the interpreter prior to the encounter, because you can kind of give the interpreter a heads up as to, okay, hey, this is what I'm about to tell this patient, and it may be sensitive or it may be something complex. And just having that conversation helps the interpreter also kind of get to speed and just be okay. For most of the things that are very common, most interpreters and kind of see it on a regular basis, it's pretty straightforward. But there are some rare or more complex situations which you kind of need to take more time and in addressing those.
Thank you, Gezzer. I pretty much knew there wasn't a better person to answer that question. And I think we're slowly running out of time here. So Hunter, you'll let us know if we've got to kind of exit. But I did see that Jeremy Aldrich kind of did put up a question around, what can community colleges and high schools do in order to produce more qualified interpreters? And, we think that, education often responds to market need. as well as drives market need, but there is a response factor in there. And as language is so absolutely fundamental to everything we do, just like math, you know, we see the significance in education take off. We would like to see language not just treated as its own kind of vertical, but we would like to see language treated as, you know, sort of the thing that sits beneath all these different, you know, kind of functional areas and different subject areas. Because again, what language does to every kind of, you know, subject area is essential, but we do absolutely support kind of more certification. And I think as programs see that there is so much more kind of career path oriented work in interpreting and in language, you know, translation and just language services in general, there will be more of those. And I see one more question here. Hunter, do we still have time for one more question, or are we? Oh yeah, we're gonna have to wrap it up. Info at Genie. I am CEO at Genie. If anyone needs to contact me, please do. We'd love to continue this conversation with anyone. And I just really want to thank very much our panelists again, Gezzer, Wendy, Frida, Hans. Thank you so much, and thank you everyone again for your interest in what we do. You know, we aim to leave the world a better place. Thank you.